The Food Security Act has revamped the PDS. During the discussion on the National Food Security Act 2013, there was nervousness about guaranteeing food security through the public distribution system. The nervousness stemmed from the poor record of the PDS according to the National Sample Survey data in 2011-12 at the all India level. Leakages were at 41.7%. The main argument in favor of continuing the PDS was that states that had undertaken PDS reforms had witnessed major improvements. Between 2004 and 5 and 2011 and 12, several early reforming states saw a dramatic reduction in leakages. Bihar 91% to 24%, Chhattisgarh 52% to 9%, and Odisha 56% to 25%. With the same package of PDS reforms being mandated by the NFSA 2013, there was a hope that more states could improve. The NSS Household Consumption Expenditure Survey data of 2022 and 2023 bears up this hypothesis. The HCES is the first large scale nationally representative survey after the implementation of the NFSA 2013. It suggests that the PDS leakages were down to 22% in 2022-23. Understanding the data and methodology, PDS leakages refers to the proportion of the PDS rice and wheat released from the Food Corporation of India that fails to reach the consumers. Leakages are estimated by matching the NSS data on the household PDS purchase that offtake data reported in the monthly food grain bulletin of the Food Ministry. During the reference period, August 2022 to July 2023, the PDS ration card holders were getting NFSA grain 5 kilos per person per month for priority households and 35 kilo per month for Antyodaya households. In addition, they got Pradhan Mantri Garib Kalyan Anna Yojana gain till December 2022 when PMGKAY COVID-19 relief was discontinued. To arrive at the estimates presented here, of taken under the NFSA, including the tide over rations, non-NFSA and PMGKAY is matched with HCES 2022-23 PDS purchase of paid for and free wheat and rice households. It is worth bearing in mind that these are estimates, the best possible with available data. Any mismatch between offtake and purchase is attributed to leakage through there could be other reasons, transport losses, lags in supply, and so on. For instance, the table shows how lagging offtake by the month July and June yields a lower leakage estimate of 17.6% than if we match the offtake with NSS reference period August and July 18%. 18.2%. Both, however, are underestimates. Why underestimates? Because some states run at an expanded PDS of providing PDS grains to non-NFSA beneficiaries using central contributions, for example, tide over rations and non-NFSA allocations, as well as state contributions, for example, local procurements. For example, Chhattisgarh's Food Security Act passed in 2012 made the PDS quasi-universal using local procurements. The All India leakage estimates of 17% to 18% are underestimates because they only take into account the central contributions and not the state contribution. There are 14 crore non-NFSA beneficiaries, of whom at the most 6 crores are supported entirely through the state contributors. If we add the state contribution for the state supported non NFSA beneficiaries to the total offtake, the all India leakage estimates rises to 22%. Impact of NFSA on PDS coverages. Uh, on the major PDS reforms included in the NFSA 2013 was an expansion of the PDS coverage that was aimed at reducing exclusion errors but had a spillover effect on reducing leakages in 2011 and 12. Before the NFSA, less than 50% of the households had ration cards, and the proportion of the households getting anything from the PDS was around 40%. That was an improvement over 2004-5, when less than a quarter of households were accessing the PDS. The improvement between 2004-5 and 2011-12 was driven by reforms in states such as Chhattisgarh and Odisha, where the PDS coverages increased substantially in this period. For instance, in Chhattisgarh, there was threefold increase from 21% to 63% in the proportion of households using the PDS. According to the HCES data in 2022 and 23, the proportion of households buying from the PDS has increased further to 70%. In the large part, this is the result of the rollout of NFSA. In spite of the improvement in the coverage, the center is falling short of the coverage mandated by the NFSA, 50% of the rural population and 75% of the urban population, i.e., around 66%. Earlier work based on administrative data suggested that only 59% are accessible to PDS as NFSA beneficiaries. Similarly, according to the HCES, out of 70% who access the PDF, only 57 to 61 have NFSA ration cards, and that is around 10% are non NFSA beneficiaries. PDS reforms undertaken by the early reforming states such as Chhattisgarh and Odisha included a reduction in PDS prices, doorstep delivery of food grains, digitalization of records, deprivatization, privating management of PDS outlets by handling them over to the panchayats and self-help groups. These reforms were incorporated in NFSA 2013. As mentioned earlier, 2011-12 leakages estimate in the early reforming states that already crashed. Since then, most states with high leakages have managed to reduce them. According to the HCES 2022-23, it was 9% in Rajasthan, 21% in Jharkhand, 23% in Uttar Pradesh. Many believe that in the integration of Aadhaar, especially Aadhaar-based biometrics authentication, led to improvements in the PDS, and data from the primary surveys, however, do not support this. Two surveys in 2017 in Jharkhand shed light on this issue. A study by the Molyendran, Nairoves and Surukandar found that leakages before the introduction of the ABBA were already less than 20%, and these Khera and Somachi reported that purchase entitlement ratio, the proportion of the entitlement that people actually purchase in offline villages and ABPA villages, were virtually the same, that of 94% and 93% respectively. Both surveys found little evidence of the ghost cards. Somewhat puzzling, leakages in states where the PDS traditionally worked better have not experienced further improvements. In fact, in some estimates, leakages have increased. For example, in Tamil Nadu from 12% in 2011-12 to 25% in 2022-23. In perspective, the PDS is now a functional instrument of social policy, guaranteeing a modicum of food security to many. During the COVID-19 lockdowns, it formed the backbone of relief efforts along with the National Rural Employment Guarantee Act. However, the PDS remains an endangered instrument of social policy are constantly subjected to innovations, and these include cash transfer experiments, doorstep delivery to people's home, for example in Delhi, and imposing inappropriate technology such as biometric based Aadhaar authentications. Instead of expending energy on ill conceived measures such as the ongoing eKYC drive from the PDS that can easily derail the PDS, scarce government capacity should be channeled to expanding the delayed census that is leading to the other exclusion of over 100 million people. Other demands such as the inclusion of more nutrition items such as pulses and edible oil remains relevant.